So good afternoon and welcome. My name is Ann DeLaurie and I am the program director for the IFC. It's good to see some new faces and it's good to see some familiar faces with us at this gathering. We're really pleased to present to you today the third in our Interfaith Dialogue series online, addressing faith in this time of crisis. When we first envisioned this program, it was the beginning of the global health pandemic, when the focus of our crisis was primarily the threat of the COVID virus itself. But in recent weeks, a second pandemic of racial and economic injustice has come into sharp focus. And we know that these two pandemics are overlapping and that those most vulnerable to COVID are communities of color. And so as we speak of bringing presence to those most vulnerable today, we really can view it from multiple overlapping dimensions of race, economic well-being, and health. Our forum today will give us a chance to hear from three leader practitioners from distinct religious traditions and professions about how their faith supports and challenges them as they bring presence to those most vulnerable. Their presentations will help catalyze our own personal reflections and sharing during small group dialogues. Our hope is that when we come together in community to learn about and reflect on how our diverse spiritual beliefs are addressing suffering, loss, and injustice, it will lead to solidarity and inspire positive action. The format for our gathering will be a combination webinar and interactive meeting. Our speakers will share in a moderated dialogue for the first part of our time together. As you listen, we invite you to comment in the chat when you hear a salient point, have a question, or would like to hear more about something we said. Our moderator will pause now and then to intersperse audience feedback into the dialogue. After about 40 minutes, you'll have a chance to reflect and share more personally in the small group breakout rooms. At this time, you'll refer to the dialogue questions that were shared with you in the agenda to guide your discussion. I have also shared that document in the chat. If you, for some reason, did not receive it, you can open it from the chat. So once our small group dialogue session is over, we'll come back together and you'll have a chance to share something meaningful that came out of your discussion. As we begin, I want to direct your attention to the chat feature and the mute button, just to make sure everyone knows how to use those. So the chat is in the bottom menu. And if you click on that, you'll see a box open up to your right where you can write a message. And I know all of you know how to mute because you just did at the start of this gathering. Now I want to introduce you to our program moderator, Amber Khan. Amber's full bio, as well as that of all of our speakers, is included with the material that was emailed to you in advance. So I'll just briefly give you a little taste of who Amber is and what gifts she brings to us today. Amber is the executive producer and host for Interfaith Voices, an award-winning public radio program broadcasted on WAMU that explores how beliefs intersect in public life and influence our interconnected world. Her reporting is informed by work as a field organizer, policy advocate, and strategic communications advisor. Although Amber is Muslim, she credits her third-grade Catholic school teacher for her interest in religion and politics. I just love that, Amber. I think it's such a great example of how interfaith encounters can shape us. Amber, we're so blessed to have you serve as our moderator today. Thank you. And I'll hand the program over to you now.
I think Amber is on mute.
Okay, Amber, we can't hear you.
Unmute. Can you hear me now?
Yes.
Okay, great. Oh, I see I'm on two different screens here. I'm sorry. Give me 1 second. Okay, there. Can you hear me now? Yes, you can. Okay, great. I apologize. Give me 1 second. Let me leave one meeting and seeing if I can just be in this.
We can't hear you.
Can you hear me now? No?
Yes.
You can hear me now. Okay, I apologize. I'm going to have to take this headset off. I was trying to tape actually our conversation, and so we will have to take a break from that. Thank you, Anne, for that, and welcome to all of you. It's exciting to be a part of this conversation, and I think it is incredibly timely. The question of presence is one that I hope that we can reflect on, and I'm personally very much looking forward to our conversation with our panelists today. We don't have that much time, and we have some phenomenal, I think, points of view, both from our speakers and from those of you who are joining us today. So I want to go ahead and get started. As I do that, I want to introduce those who we have with us. And as Anne mentioned, you have the panelists' bios in front of you as well. I want to start with David Balto. David is one of the two attorneys that's on our panel today, but he is, in addition to that, a chaplain with the Washington Hospital Center. And he ministers to people of all different faith traditions. And I am particularly looking forward to hearing from David and his reflections of what this time and what ministry as a hospital chaplain looks like in our world. We also have Jackie DeCarlo, who serves as the Manna Food Center's Chief Executive Officer. And particularly in this time in which the demand for food and hunger has taken on a new urgency, eager to hear from Jackie on how her organization and how her work is addressing that need. Jackie's leadership, as you'll see in her bio, in this area is extensive, and no surprise, the county executive, Mark Elrich, has asked her to serve on the Emergency Response Task Force in responding to the pandemic and the needs that have grown out of that. Jackie's faith tradition is the Quaker tradition, and she is a member at Bethesda Friends. And I am also looking forward to hearing how that influences and shapes the work that you do and how you see it. And then we have Fazia Deen, who is also an attorney and a member of Darul Hijra Islamic Center in Falls Church. She's the Deputy Outreach Director there, and in her capacity as a volunteer, she has taken on a role specifically in offering ministry and supporting young adults in the DMV, specifically around mentorship and addressing issues like equity and justice. And I think that she also brings an international perspective. She's lived in many parts of the world and is also the mom of 3 children. So we are looking forward to Fazia's perspectives as she is hearing issues, and also how she brings her faith to the work that she does with young people. So I want to get started, and I want to begin with this question. And David, if we can start with you. If you could describe a little bit of your work for us, and specifically how you arrived from a faith perspective, what spiritual belief or feeling that you had that drew you to the work of chaplaincy.
Thank you so much, and I'm really honored to be invited to speak here, and I'm honored to be with all my fellow panelists. We're instructed, Jews are instructed to attempt to walk in God's ways. So as God comforted the mourner, so are we. As God feeds the hungry, so are we supposed to. As God helps those who are sick, so are we supposed to do this. So I see it as fundamentally my opportunity to go and help in God's work and helping people feel His presence and bringing healing and comfort in very difficult situations. Now, I walk into this situation with a key lodestar, which is the commandment that is most often mentioned in the Old Testament, that of welcoming the stranger. We were once strangers in the land of Egypt, and so we're supposed to recognize the challenges that strangers face. And I think that's a clear commandment for me in my work, especially in dealing with people of other faiths. By the way, Jews are an incredibly distinct minority at the hospital. It's a 1,000-bed hospital, and typically the number of Jewish patients is about 5 to 8. There are 3 skills I focus on. I think it's vital for me to take a broad perspective of my faith and the fundamental principles of that faith. And that's one of the things I love in interacting with people of other faiths. Second, it's important for me to be curious. There's one of the greatest things about being in such a diverse religious setting as the hospital is how much you learn from people of other faiths. And finally, I think it's important to put your heart on the line. Be personally vulnerable. Let people's stories affect you. And I think in doing that, you can be a compassionate presence and help people feel God's love and comfort. So that's the way I approach the job.
Thank you, David. Jackie, I want to turn to you. If you could share with us how your spiritual beliefs, how your faith tradition drew you to the work of confronting hunger.
Thank you, Amber, and thanks everyone for being part of the dialogue. I'm really looking forward to the breakout sessions, and I'm honored to be with Fazia and David on this panel to get us started. As Amber mentioned, I am currently a member of the Religious Society of Friends, which is a mouthful that most people know as Quakers. But I was actually raised as a Roman Catholic, and Catholics are not known for studying the scripture, but I was in my early days kind of motivated by the notion and the teaching that to whomsoever much is given, much will be required. And that's kind of followed me throughout my journey. I, during high school, felt called to be a priest, but the local archbishop explained to me that that wouldn't be possible. So I found my way, the short story is I found my way to Quakerism. And in Quakerism, we have several testimonies. It's like every great faith tradition, guidelines or principles or philosophies. And what really is manifest for me at Manna Food Center is the notion that there's that of God in everyone and a call to be in community with people. So Manna Food Center is focused, as you might imagine, on feeding people. We are an anti-hunger organization, but really our vision is that that all people at all times will have access to good food in welcoming spaces. So we have a hospitality function, and we believe that food can bring people together. And if we bring ourselves together around the power of food and culture and nutrition, then we can all be better nourished and equipped to create a community where everybody lives in dignity. So those are some of the touchstones that arise out of Manna's mission and values, but resonate with the Quaker belief in that of God of everyone, and equality and community. And those are some of the things that I bring, particularly these days, to the COVID situation, because we are not serving food in the same ways as we usually do, because we have to be so much more concerned about safety and how to keep being dignified and how to keep being welcoming, while also reaching 40% more people than we would have otherwise expected, is a challenge. But I know we have a question about challenges coming up, so I'll stop there.
Thank you, Jackie. I definitely, there's a part of me that wants to get right in and start asking both you and David questions. But before we do, I want to hear from Fazia, and I see you shaking your head. We've heard now about the call of welcoming the stranger, the need of addressing and thinking about vulnerability in the context of food. Fazia, talk to us a little bit about what your belief, like how your beliefs kind of inspired, or rather drew you to this work through your relationship with Darul Hijra Islamic Center in Falls Church, Virginia.
Fazia, you need to unmute yourself.
Oh, there, can you hear me now? Yes, I am so grateful to be here today among you guys, and thank you for all the participants. So I'll get right to the answer of what inspired me through my religion. And I think that, like all of you have mentioned, I too are from the religion of Islam, but in Latin America. And in Latin America, at the time I was living there, there might have been 9% of Muslims. So you can imagine, I went to Catholic school myself. So one of my earlier influences would be my parents. We were business people and we owned supermarkets, and every Friday I would watch my father and my mother prepare for these long lines of people that would come and line up for rations, like the food pantry. But I didn't know at that time as a little girl, food pantry. So that influence of watching that your parents are doing that. Another influence for me to this work that I finally got into is Mother Teresa. I loved her for some reason, the way she just gave herself to the work. And that was also an influence. And most currently, leaving the attorney world, where I did juvenile law and I worked with the indigent, I worked with the immigrants who couldn't afford services. I was moved to through some circumstances to here in Virginia, where I met Imam Johari, who then opened up this world of working with juvenile delinquents in Justice for Juniors in Washington, D.C. at the Youth Detention Center. So what drew me is many things. The urgency to help the most vulnerable, absolutely. And I do want to say that in our own religion, as you all have different quotes from the Holy Scriptures, I want to mention that we have in chapter 5, or we say Surah 5, verse 8, it says, "O you who believe, be persistently standing firm for God. Witnesses in justice, and do not let the hatred of people prevent you from being just. Be just, that it is nearer to righteousness, and fear God. Indeed, God is acquainted with all that you do." And that is also an urgency under, is pushing me forward every time I see that. But yeah, good examples in our life. I just want to answer that question on that note.
Thank you, Fazia, for that, and I appreciate you sharing this scriptural kind of inspiration for you. I think that for different people who draw from traditions, some scriptural, some lessons learned in their communities, others from many traditions. I often find in conversation over the last 3 years hosting the program, I'm always surprised sometimes to hear the way in which one integrates lessons and principles from different practices, especially in times of struggle. So Jackie, I just want to get right to it. You are facing a demand when we talk about vulnerability and understanding what that looks like in a time that is extraordinary for many, many reasons. How are you responding? How are you coping with the unprecedented need for the services that you are providing and the families that are coming to various community-based organizations to support their food needs? How are you approaching that as a leader? And then how do you grapple with that challenge on a personal level?
Well, from an operational standpoint, what we have done is we've basically re-engineered everything. Our model was more of a choice model where people could come into different locations in Montgomery County and choose what was right for them, for their family size, their culture, their preferences, their health needs. And we've had to change all of that and go low contact. So we have now basically drive-throughs where people and people who are reliant on public transportation can walk up, but everything is in a prepackaged box. There's no contact. Things are done through windows being rolled down. It's very impersonal, and yet it is efficient and it's safe. And we do want to be as safe as possible. Another thing that we've done is we have changed our some of our technology so that we can now do deliveries, because so many people needed to, in fact, stay at home. So food runners, volunteers who would typically take a plate of lasagna left over from a restaurant and take it to a soup kitchen like Shepherd's Table or Bethesda Cares, we've actually kind of redeployed them to pick up these packages of food, which we call state put packs, and take them to people's doorsteps, so that definitely people who are in compromised conditions or fighting COVID or just simply need to stay at home, they can get those deliveries. So those are some of the operational changes that we've made. But the challenge that's had the most impact on me spiritually and emotionally is, and it's one of the reasons I have this little kaleidoscope behind me, is that I'm actually not on the front lines. My team is representative of Montgomery County. We're a county majority people of color, lots of low income folks. We pay a living wage, but these are all working class people, and they're putting themselves in harm's way. And so one of the things that I've really had to focus my leadership on, my advocacy on, and also my care, almost of a pastoral nature, although I'm not trained for that, is keeping people safe. And so one thing that we've done that seems small but is really helpful is staggered schedules. So the people that are sharing food work for 2 days, but the third day they get off, and they get paid for being off so that they can rest and reduce their exposure. We're also, of course, providing hazard pay and PPE, but we're also trying to create spaces where people can talk and share some of their fears and anxieties. So working with other nonprofits that are in the mental health space and their expertise, we're trying to give resources to folks who are struggling with the fact that their jobs as humanitarians are putting their own families in danger. And so I had one colleague talk to me and say, you know, I was not a praying man before this, but now I'm worried that I'm gonna get my 7-year-old sick. And he one morning before he went to work, he explained to me he was praying over his son, and his son woke up and said, you know, Dad, what's going on? He explained, and his dad and his son said to him, well, Dad, I'm proud of you because you're helping people. So I feel like it's it's certainly making positive things happen for people, but it is definitely, we're getting food out and people are having conversations with their kids they might not ever have, but it is a tremendously full moment of emotion and anxiety.
Thank you, Jackie, for sharing that. And that story specifically about the volunteer network and the staff that you have that are part of this system of delivery and meeting needs, and the spiritual and emotional and mental health toll that the pandemic is creating for those who are serving, has me immediately thinking about conversations I've had with healthcare workers and folks in the hospital community. David, can you talk a little bit from your perspective how your chaplaincy has changed and how you are challenged by the circumstances of created by COVID-19, and the way in which you are drawing upon your and other traditions to minister to the different needs, both of patients, but also of the staff within the Washington Hospital Center?
Well, it's not like anything, thank you for the question, it's not like anything we've ever experienced before. You know, the normal course of affairs would be an unfortunate demise of a patient to have the family around to help the family and the beloved one have those final moments. Give them the time to embrace and communicate and all those things. That's just missing, and it just creates a tremendous hardship for the families, which can't be with their loved ones, and also for the staff, which is used to working very closely with the families in helping them move through this extraordinarily painful time. And so we do a whole variety of things to try to, first of all, from the family perspective, try to give them the opportunities to communicate as best they can. And the nursing staff is trained to really help out in that ways. We've also, if you're in the situation where a nurse is there near end of life, you know, we try to explain to the nurse end of life traditions so that they're aware of it. You know, we've had situations where, you know, nurses are very cognizant of the, you know, for example, the Jewish obligations of the proper way to prepare a body immediately after death and things like that, things that they're very sensitive to. So, and I think, you know, I think it's always important to reflect that we're coming after people. We're coming, you know, we have parents and grandparents and great-grandparents, generations before us that have faced very, very severe conditions. They've found ways to survive. They've found ways to be resilient, and to tap on some of those four sources of strength and resilience that help them survive, hopefully help us, help us to survive.
Thank you for sharing that. Is there any particular intervention or activity that you found to be particularly helpful in this time that, you know, is new, that you would never have imagined as providing support or counsel at a time when we have such isolation, especially when we are in a hospital or ill or unable to mourn and grieve together?
So I have an example. So one of the things that I've tried to do is because you don't have the interaction with the family, you don't know the patient. I sometimes ask the families to write a description of the patient and then post it in the room. So that way, you know, the nurses and doctors see a more complete picture of the human being who's lying in bed in front of them.
That's really powerful. And that brings to mind a question that I had when I saw the topic for this conversation about vulnerability. Oftentimes, vulnerability is presented as a weakness. It's presented, and it is, when I think about a dynamic between those who are strong versus those who are weak, in the way that we're raised, in the way that we think about it in our society. I was wondering how you define and how you see vulnerability. What does vulnerable mean to you through your work, and as you come to think about your own role? in this relationship of service. Fazia, can I ask you that question? You have to take us off mute.
I don't remember to do that. So I'm in awe. I'm listening to this conversation at Dara Hijra, of course, similar to the work of the other panelists. We do have an outreach department that's run by a chaplain as well. That's my immediate supervisor. And then we also have a social services department. Now, focusing on what I'm here to talk about today and your question about vulnerability, it's very different, the vulnerability of the people you're serving in detention centers. So in the detention center, when we talk about pandemic, there's two things, right? It's not just health, it's also that it's affecting the Black population. And so that's the difference when you're talking about people who are detained in the justice system. So as far as vulnerability, I would say that the Black population that's being detained is already vulnerable. And they're also vulnerable to COVID-19 restrictions because they're the ones that are, it's affecting a larger proportion of them. And so when we, and then a pandemic itself is not just in health, but it's also in systemic racism. I can't have this conversation with you today without mentioning that the systemic racism, not just in the healthcare system, but also in the justice system, right? So that makes especially the teens that I work with now in the detention center in Washington, D.C. extremely vulnerable, right? So the question is, though, what have we been doing? Did you want me to talk specifically why I think they're vulnerable, or specifically what we are doing in activities now through COVID-19 restrictions?
We could talk. I'd love to hear about what you're doing now in terms of dealing with the challenge with COVID-19. But I would also like you to just answer what that word vulnerable, based on the work you do, what does that word vulnerable mean to you?
So vulnerable for me is when you are not able to have certain rights. So you're vulnerable, you're restricted, right? And so you have, in the population that I'm working with, which are teens, they're vulnerable because they're no longer allowed out of their pods, which is what they're called. So they're already at risk from where they come from, which is the inner city of Washington, D.C., specific population. That's a much needed area. And then the teens are already the ones that are being picked up and being put into detention centers, right? So that's the vulnerable population because they're at risk already. So that's what vulnerable means to me. So when I go in to work with teens in the juvenile system, I didn't know that. I guess I was naive coming out of Canada, coming out of Indiana. When I walked in for the first time, 99% of the population in the Youth Services Center are young Black teens. That's what vulnerability means to me. So if I'm just going to answer that portion, that's what vulnerability means to me. And as far as activities that we're working with at this point, we used to go in every Monday night, and we have a group of volunteers that are trained to help mentor these kids. And so what's happening now, because of more restrictions placed on them, they're not allowed to have us mentor them, and limited restrictions to healthcare and maybe certain family members. But we as mentors, we're not allowed to work with them or go in face-to-face and work with them mentoring. So what we did was we reached out to our community at Dara Hijra in our area, and we said, look, we have these vulnerable teens in Washington, D.C., and we need you to support them mentally, because I talked to one of the officers and the supervisors there, and they said they're only allowed for an hour or two, right? They're only allowed free time. They can go and take a walk 2 at a time. So it's very, very restricted. So what we did as a team of volunteers is create a program where people can write letters of support. And so it was very well, we promoted it through our community, and we got a multitude of letters, and they were individually, my daughter's an artist. She drew beautiful artwork on them. And we took them down to the detention center, and they were delivered to 28 teens that were still there during COVID-19 restrictions. So I don't know if I'm answering your question. There's just so much to it. It's so different from hospital chaplaincy, right?
Yeah, no, I appreciate that. And I think you're giving those of us who've never had the opportunity to be in a detention center or think about some of the struggles or challenges that young adults and teens who are in those pods and detained in these institutionalized settings, what are the struggles that they're going through? So I can appreciate your sense of urgency to share what that means and the different things that you're doing.
I just wanted to add one thing about the word vulnerability. I'm so sorry. Is that, do they think they're worthy? And some of them, you know, it's us against the world. So vulnerability, again, are they feeling that unworthiness? I'm not worthy enough to have a visitor. I'm not worthy enough, so I'm going to be detained. And then for a handful of them, it could be pride. I don't need your help. So vulnerability can come on different levels.
That's an interesting point. David, I'd love your perspective. I'd love you to jump in on this vulnerability. I think about, and I've heard from other chaplains that I've talked to around the country, can mean something very different in the context of a hospital environment. What do you see? What has your experience been?
I certainly admire Fazia's work and the really vital effort she's involved in. In the hospital setting, when you're trying to be a compassionate presence for someone, you have to yourself become vulnerable. You have to, one of the things, you know, that can be very helpful is just to imagine yourself in the patient's position. Imagine if that was going on for you, how would you feel? Touch things inside yourself that may trouble you. And in being in that more vulnerable position, I think patients recognize that, and it lessens the distance between you and the patient. And I think it makes you more effective at bringing God's compassion through you to the patient, so they feel that they really feel comfort.
David, thank you for sharing that. I want to ask you all, this is an extraordinarily difficult time. When you think about the operating challenges that your different agencies and organizations and volunteer groups are facing, and the anxiety and the trauma that people are facing that may have not seen themselves as vulnerable, but now do. They find themselves ill or find themselves confused about how to make ends meet and whether or not to reach out to a community-based group and drive up to get one of those meals that you're talking about, Jackie, that that Manna is distributing. How is it that you see faith communities in this area responding and engaging? Hello?
Is that for me?
Yes, Jackie?
Amber? Yep, sure. I just got a different screen somebody seems to be sharing.
I saw that too. Threw me for a second. Okay. So Jackie, I would love for your perspective on that, because vulnerability and bringing presence to vulnerability sounds so calm and it sounds so serene. But I want to say I've seen anxiety, I've seen trauma, confusion for folks who are facing unknowns that they never imagined. And I know food is one of those areas. In Montgomery County, I heard the shocking statistic from Evan Glass, City Council member, that over 2 million meals have been served in Montgomery County last month. And that number really just took my breath away. And I was thinking about where and how faith in the faith community has been responding to that heightened sense of vulnerability. What are you seeing?
Yes, most definitely the faith communities have stepped up, as well as individuals. And I see some people on the screen that are doing their own activism and their own humanitarian work, which is wonderful. And without knowing their stories of what the inspiration is, the the connection that Manna has had over the years, we actually we're a secular organization, but we were founded by about 20 different congregations in the Judeo-Christian tradition back then, but now we have lots of different organizations of faith traditions, Buddhist and Baha'i and Islamic. And so the nice thing is that those ministries already exist and those relationships already are there. So, but again, what has happened is we're all contracted in one way or another. So for instance, in the Jewish community, a lot of congregations during Yom Kippur do food drives for us. Doing a food drive now is a very different kind of thing. And so there are food drives that are being organized where people are leaving their food out on their front doorstep, and then members of faith communities are picking those things up and bringing them to our warehouse. So there's a lot of ingenuity to it, but certainly faith communities have turned to Manna and said, okay, what can we do from a financial standpoint? We've gotten a tremendous response, which is really so gratifying and humbling, because it's allowed me to do things like give time and a half and hazard pay. And then the desire to volunteer or to give food. But I also see a member or someone connected with Faith United Methodist Church. That was a congregation. They said, well, we're going to write you a check, but we can't do a food drive. We can't volunteer at the warehouse. What can we do? And so I asked them to write hand notes to all of the staff on the front lines. And that was a way to connect person to person. And I think that has a healing thing for the writer who's writing the notes, as well as the receiver of the notes. So there's just been some creative ways that faith communities or members of faith communities have come together. And that is one of the energizing things about this whole situation.
All right. I'm just mindful, we are now at that point, we want to get you in here. Those of you who are watching and listening, would like to start the process of moving into question and answers. So do you have any, as you have questions, you can take yourself off mute, or you can chat, submit a question via the chat. And I know we have someone we have Christopher from West Africa. It's so great to see you, Christopher. I don't know if you can hear me. Hi, it's fantastic to have someone all the way from Liberia. Thank you for joining. So,
thank you.
So one question I'd like to ask, I'd like to just start off. First of all, does anyone have a question, a burning question that they'd like to ask of one of the panelists? Still absorb. Okay, all right. So let me ask you this question. As you all are looking at the weeks ahead, and you've described kind of the work that you're doing, and you're all very positive, but I want to ask you a question about your own vulnerability. Has there been a time in which you have felt vulnerable or you have struggled, and how have you gotten through that?
Well, I can start, and I want to thank Fazia for mentioning the issue of racism. We touched on it at the beginning, the introductory remarks, and it's certainly not a new phenomenon, but the horrific murders of late, as well as the COVID crisis impacting disproportionately, as I think Anne started the conversation, people of color. It's really, for me, and I don't think of it necessarily in a white fragility sense, but it's just caused me to make sure that I am centering myself and trying to step out of the way of leaders of color in the organization so that their voices can be heard and they have safe spaces to help chart the strategy. So I think that that's one of the vulnerabilities as a white person, and then also wanting not to fall into the trap of, you know, the Savior. Manna is one of the largest organizations in Montgomery County, and we do have dozens and dozens of faith groups, and we want to get out there and do our thing and feed people. But we have to be humble of the fact that we are, to some communities, we are not a trusted organization, especially undocumented, or some communities that feel a lot of stigma around asking for help outside of their cultural groups. So that's how vulnerability has kind of displayed itself for me, as making sure that I'm attentive and I use my power in the right ways to empower others as much as possible, or to listen and learn and observe from others. Totally imperfectly, but that's what comes up for the question.
Amber, I can go next.
Fazia, actually, before you do, I'm just mindful of the clock. We're now gonna break into some small groups. And Jackie, I want to say thank you for sharing that and for addressing some of the challenges and the way in which you are thinking about your own leadership and the role that the organization plays with not only those who you work with, the community-based organizations, but the community that you're there to serve and to work with and provide leadership to. And the mindfulness about that is something that I'm sure some folks may want to talk about in the small group conversation, small group discussions. So we're gonna now move to that portion, and I'm gonna kick it over to Anne. If you could walk us through how we're gonna take on the stepping into virtually the small group rooms.
Thank you so much, Amber, and thank you, Jackie, Fazia, and David, for that very rich discussion, which I expect will catalyze much reflection in our small group dialogues, which we're about to go into. So momentarily, you will be asked to join a breakout room. So there will be a box on your screen that says you've been invited to join a certain breakout room, and I invite you to join that breakout room. There will be about 5 to 6 people in each room, having some time to reflect and dialogue together for about half an hour. When the time is about to be up, you'll get a notification letting you know that you have a minute left, and you can start winding things up at that point. But the dialogue questions and the guidelines for dialogue were sent to you in advance. They were part of the agenda and bio material that was sent, and I also shared that again in the chat. When I break you into the groups, I will also type in the chat what those questions are in case anyone's having trouble accessing them. And most of the groups will have a prepared facilitator assigned to them. There may be 1 or 2 groups that does not have one, and I just ask that someone from the group volunteer to do so. It's fairly simple in that we're just asking that each person have a chance to speak uninterrupted for a minute or 2 on each question. And once that's happened, then we invite crosstalk, where you can engage one another, ask questions of curiosity so you can learn more from your neighbor to deepen the dialogue. So let's get started with that.